So basically, female sexual disorders from a male and female sexual cycle point of view are: number one, those females with hypoactive sexual ड्राइव डिसऑर्डर. दैट मीन्स बेसिकली उनकी जो भूख है, उनकी जो प्यास है सेक्स की, वो ही कम हो जाती है या कम रहती है. देयर डिजायर फॉर सेक्स hypoactive, okay, either there is totally absent or the women are having less amount of female sexual libido. They are not having the urge, they are not motivated for the sex, they don't hence go on looking for the sexual partners, those who are having that problem. So this is one, lack of sexual desire or libido in women. Number two, lack of sexual arousal, जिसे पहले frigidity कहते थे, frigid, rigid, okay, where now this word is not used. Actually, it's all play of semantic. I personally feel I am not a sexist person, and I do not. You must have come across my videos and seen that I belong. I believe more in existential individualism rather than the gender or the sex and the male and female or feminism and masculinism. Okay, I don't believe in all these things. Means I know that the difference is going to be there, but I am not polarized. Okay, so I hence personally feel that similarly, uh, I personally feel that the older terms were quite apt because they described everything properly. But now one has to sublimate them, one has to soothen them. Okay, तो यूफेमिज्म हाइपरबोल नहीं होना चाहिए, यूफेमिज्म होना चाहिए. एनीवे, सो द थिंग इज दैट that frigidity I was saying. So the women, even though has a sexual desire, in frigidity or rigidity state or lack or disorders of sexual arousal, the women doesn't get aroused. So her clitoris will not become erect. She will not get lubrication. She will not get that excitement. या कुछ होता है. She will not get the palpitation, the increased breathing, something happening in the stomach, and that sexual thrill and sexual adventures. All this is lacking. She might have a desire, but okay, so the rocket is ready, but not the rocket is not ready to get launched or propelled. Okay. Then comes the uh, desire of disorders of copulation or sexual intercourse. So in that there is something called as vaginismus, ज्याला मराठीमध्ये योनिखीळ असं म्हणतात. आणि that असते ना, so this is a spasm of the muscles. I cannot open, okay, my upper and lower jaw, and there is a stress and interlocking, and nothing can go inside, neither the finger nor the spoon. Okay, so and this is spasmodic, involuntary, continuous. So in vaginismus, there is something like this dental, we call it as a trismus or the spasm, and ओके लॉकिंग हो जाता है और ऐसा हो जाता है, तो अंदर पेनिस जा ही नहीं सकता. इट कम्स मेनी टाइम्स आउट ऑफ एंग्जाइटी एंड फियर, ऑटोमेटिक spasmodic continuous state of contraction of the thighs, pelvic muscles, and the vulva and the vagina and the vaginal vault and the vaginal muscles, and the penis can't go inside. uh, and then there are disorders of something called and there is a disorder something called as a pelvic pain disorders or dyspareunia. Dyspareunia is a sambhog shud while having intercourse, severe amount of pain. So there is only pain and suffering of intercourse and the pleasure is lost. And in a genitopelvic pain disorder, the intercourse happens, but deep level inside the pelvis, in the lower part of the abdomen is pain, uh, and especially while thrusting movement of the penis of her male partner, or after the penis or the vibrator or dildo or whatever inserting element is withdrawn, afterward she starts getting pain. And in her urinary system, rectum, uterus, vagina, pelvis, lower abdomen, wherever. And the last disorder is a disorder of anorgasmia. That means डिजायर है, ड्राइव है, मोटिवेशन सेक्स के लिए है, अराउजल भी है, लुब्रिकेशन हो गया है, कुछ कुछ होता है अंदर से, मन में, शरीर में, एडवेंचर है, थ्रिल है, पेनिट्रेशन भी अच्छा है, समटाइम्स फीमेल इजैकुलेशन भी होता है, मगर वो जो तृप्ति संतोष है, that wow feeling of orgasm is not there. She cannot experience it, she cannot feel it. And these are the fundamental disorders. And then there can be disorders related to touch. So many things are there. Disorders related to intimacy, togetherness. Maternal disturbed life can affect sexual life, and vice versa. And women can also have a sexually transmitted disease, STD. And ये सब काफ़ी बड़े बड़े चीज़ें हैं, बहुत बड़ी है फीमेल सेक्सुअलिटी भी.